What are 5 determining factors when considering surgery for spinal stenosis? Here we go. Okay, so for today's video, we're going to talk about surgery, but just to clarify, I am not a surgeon. I'm a physical therapist, and what I'm doing today is I'm simply sharing in my decade plus of experience working with patients with spinal stenosis. I'm sharing some common patterns I've seen in people that end up having surgery. So I hope this is helpful. If you're enjoying this content, please subscribe to my channel. Let's go. Okay, number one is sudden bowel or bladder changes or pain or numbness in the saddle region, in the groin region. This is often an indicator of something very serious, a medical emergency, cauda equina syndrome. So this is usually a pretty cut and dry type of thing, and it leads to surgery. Number two is your spinal cord at risk of being seriously damaged. This is usually something that your surgeon will tell you based on imaging that they've done. If you're, if there's such a narrowing of that central canal that you're one little accident away from a spinal cord injury that could result in paralysis of your legs, that's usually an indicator for surgery. That's just what I've observed. Number three is progressive weakness of the legs. If you find that your legs are continually getting weaker and weaker over time, unfortunately, that's not a good sign. There is a point of no return with that weakness. If you let that weakness go for too long, I've seen folks that have waited for too long, and then when they finally did have surgery, they couldn't get the strength back in their legs. So continual progressive weakness in the legs is usually a troubling sign that often leads to surgery. Number four is repeated falls. If you have diagnosed spinal stenosis, there's narrowing of your central canal, and it's leading to episodes of your legs giving out on you, and you're having recurring falls. There's just a limit to how long you can go like that. If you're falling over and over again, eventually it leads to something bad. So that's often something that leads to surgery. Okay, and number five is unrelenting pain for an extended period of time, 6 months, 8 months, 12 months. In my experience, if somebody, if you don't have any of the previous 4 issues, if you don't have any bowel or bladder changes, if you're not at risk for damaging your spinal cord, if you're not having progressive weakness in your legs, and if you're not repeatedly falling, in my experience, surgeons don't rush to do surgery. There are cases where someone is just having extreme, unrelenting pain, have any of the previous 4 issues in the legs and the back to where they just can't function. That can lead to a decision to have surgery. It's just risky. Anytime you go in for surgery to treat pain and they haven't been able to match something structurally with that pain, you just don't know what you're going to get coming out. But there are cases where this happens. Thank you for watching today. I hope it was helpful. If you're enjoying these videos, if they're giving you good information, please subscribe, and also take a look at my free Beat Back Pain Blueprint in the show notes. And I'll see you again soon. Bye.